3 months, you can refinance or you can purchase a new home. The other thing related to forbearance, and this is, again, historical, is we are purchasing loans in forbearance from lenders, and that has been extended through September 30th, 2020. And then the last thing I sort of wanted to highlight was, and you may have seen this in the press, is we introduced a new adverse market refinance fee. So we are adding an additional loan level price adjustment, which we, when we purchase a loan from the lender. And the reason we're doing that is that there's just, because of the market and economic uncertainty, this has resulted in higher risk and cost to Fannie Mae. And as a result, we were directed by our regulator to implement this new fee. And so this new fee applies to most refinances with an original loan amount of $125,000 or higher. So we have, we initially had the effective date of September 1st. We pushed that out to December 1st based on feedback from the market. So that is, again, a new historical item on the selling and origination side. On the servicing side, really forbearances, I'll start with forbearances and then walk through some of the other things. But with forbearances, the major thing to think about is the CARES Act. That sort of, if you could move on to the next slide. With the CARES Act, that really changed how a lot of the aspects of forbearance. And so one of the key things, and moving on to the next slide, is that basically if a borrower says or a homeowner says that they are impacted by COVID-19, they are eligible for an initial forbearance of 6 months and a potential extension for additional 6 months. We also, the CARES Act also impacts credit reporting. And so this, lenders must follow the Fair Credit Reporting Act and the CARES Act in terms of how that delinquency is counted in terms of the credit score. Moving on to the next slide. So one of the big things folks always want to know is, well, what happens after forbearance? How do I get back to current? And so we did, we introduced the COVID-19 payment deferral and made some changes to our Flex mod, which is our standard mod offering in response to COVID-19. And so this is sort of what we call our hierarchy of workouts. And so obviously if a borrower can, reinstate, that's great. And that, and reinstatement means is that they make all the, past due payments in one lump sum. We know that is not, going to happen for a lot of homeowners and borrowers, that that's just not feasible. So what comes next is the repayment plan, which is you make a payment plus a little bit to catch up. Our new COVID-19 payment deferral, which I'll go into more detail in the next few slides. Our Fannie Mae Flex mod, which targets a 20% payment reduction. And how we do that is by extending the term by 40 years from the modification effective date, and potentially putting some of the loan amount into a non-interest bearing sort of amount that is due and payable at payoff. We then, in worst case scenarios, have what we call our liquidation options, which are a short sale or mortgage release. Some people might know it as a deed in lieu. Obviously, those are, we don't want to go down that path if we don't have to, but those are, potentially on the table as well. In terms of going into the next slide, payment deferral was actually a program that had been in the works for almost a year, and it's sort of, we introduced a different payment deferral in March, just as all this was happening, but then quickly in May released our COVID-19 payment deferral. And if you move on to the next slide, this went into effect in July of this year. So basically what happens if a homeowner had and can't, cure their delinquency by either, as I said, a repayment plan or reinstatement, this is the next step in that hierarchy. So a borrower coming off any COVID-related forbearance plan or in any delinquency, they don't necessarily have to have been on a formal forbearance plan, is eligible. The other thing to be aware of is that this does not require documentation. So the homeowner is not required to submit to their lender or servicer a package of material saying, you know, what is their financial situation, what is their hardship. This is just based on, you know, a conversation, or we know that a lot of our lenders and servicers have set up web portals because of the tremendous call volume that has come out. So that is, you know, a key thing. Moving on to the next slide. So what can be included in that payment deferral? So it's up to 12 months of the principal and interest, your amount owed, or your monthly payment. In addition, if you're escrowed, which is for taxes and insurance, that can also be included. And then any servicing advances that were made, if that is applicable by state law. So one of the things that is homeowners might not care about, but lenders do care about, and servicers do care about, and a lot of investors care about, is that these loans can remain in what's an MBS trust, our MBS trust. So what we do is we package, you know, thousands of loans into mortgage-backed securities and sell them, and that sort of keeps the, you know, housing finance bubble going. Because this is not viewed as a modification, and we're just deferring these payments to the end, we can keep these loans in our MBS trust, which is very, very different than a modification where the loan has to be taken out of the MBS trust and then put on our portfolio. Eventually we can potentially re-securitize them, but it does add sort of some sand and makes it a little bit more difficult, you know, in terms of that liquidity piece to keep that going. Next slide. So who's eligible? I'm getting some feedback. Thank you. So who's eligible for this payment deferral? So first off, you have to have been either current or less than 2 months delinquent as of March 1st, 2020, which was the that was the emergency declaration date. And then you have to be at least 1 month delinquent or less than 360 days or a year, you know, that 12 payments due when that payment deferral becomes effective. So that's a pretty, you know, large swath. Right now, we are only allowing one of these COVID-19 payment deferrals per, you know, COVID-related delinquency. We are looking at that. We know that, you know, with openings and closings and a lot of uncertainty, people may need assistance a second time, but that's something we're currently looking at. Next slide. So the other thing I wanted to talk about is that I thought this group would be very interested in is our foreclosure moratorium. And this is just on the single family side again. Moving to the next slide. What we have instructed our servicers to do is suspend all foreclosure related activities to December 31st, 2020. So that's everything from breach to foreclosure referral, et cetera. All those activities are suspended until December 31st. Moving on to our multifamily. And this is where probably some of the folks have heard of what the CDC has done. We also are looking at the CARES Act. So if you move on to the next slide. So the CARES Act on the multifamily side put an eviction moratorium, which expired in July 25th of 2020. That only applied to mortgages where they took a forbearance and the loan was owned by one of the GSEs, and that's either Fannie Mae or Freddie Mac. That expired. There's a lot of confusion there still. I know we are trying to work out what the CDC ruling or the CDC moratorium means. Basically, from our understanding, is that it is between the renter and their landlord, that the lender does not have any say in that eviction moratorium. So that's something we're trying to understand. In terms of resources for renters, we have a couple things that I wanted to highlight. We have the Disaster Response Network, and so this is backed by HUD housing counselors, and so they can provide budget assistance, advice on this, the various eviction moratoriums that are coming through. There's a lot of state ones out there. And so that is available to a Fannie Mae property where we own the loan. And so your next question is, how do you figure out if living in a Fannie Mae financed property? How you do that is we also have the renter resource finder, which is a tool, and you can put in your building's address and find out whether or not Fannie Mae owns that loan. And if you move to the next 2 slides down. And so how you do all that information that I just talked about in terms of the disaster response network and the renter resource finder, and that is on your knowyouroptions.com site. The disaster response network is also open up to single family homeowners. So it's both for this, owners as well as renters. And with that, I will turn it back over.
Thank you. Lots of information there, and we've collected about half a dozen questions already. We will pose those questions at the end after each of the panelists have had a chance to speak. Next up is Rob Finn from Center for Community Progress, and I'll pull up your slides here. Give me just half a minute. And that should be showing now.
Great. Hi, everybody. Thanks for having me, Stephen, and thanks everyone for joining us on the Friday before Labor Day. I'm going to talk a little bit about what our organization, the Center for Community Progress, does and the role that we play generally and that we're anticipating we will be playing in the years and months to come through this crisis. I'm the Director of Policy and Research. If you can go to the next slide, Stephen. The Center for Community Progress is a nonprofit organization that was founded in Flint, Michigan, and is still headquartered there. I work out of our Washington, D.C. office with several of my colleagues, but we are spread throughout the nation. Our organization was created in the aftermath of the last housing crisis after the Great Recession and the mortgage collapse in and around 2008. To help communities create strategies to work with their large inventories of vacant and abandoned and deteriorated properties. Many of these communities that we do work in were struggling before the Great Recession, and the Great Recession just kicked them while they were down. And so we provide technical assistance to cities, townships, counties, conglomerates of various forms of local government who are trying to come up with strategies to transform blighted and abandoned neighborhoods into repurposed assets for their communities. Most folks that do know us for our work in land banks. We have had a hand in providing technical assistance to hundreds of communities in over 30 states. And land banks have become a really powerful tool in a lot of communities to help drive equitable outcomes for what happens to their tax foreclosed properties. So when properties go into a land bank, they are not just simply sold to the highest bidder and or the investor with the most cash on hand. The land bank has the power to liabilities and liens and to take property tax foreclosed properties and determine what the best outcome for them would be. Land banks are typically subjected to all of the open meetings and transparency requirements that many other government entities are held to, and most land banks also have representation from the communities that they work in on their boards. So instead of just simply waiting for the highest bidder, they can really try and understand with city planners and local units of government and community groups, determine what is the best outcome for these parcels of land and these abandoned properties. We also throw a conference typically every 18 months when we're in normal times. Our most recent conference was in Atlanta, Georgia in October of 2019. It had our largest attendance of over 1,500 people from around the country. It was also our first Reclaiming Vacant Properties conference held in the South. And we were really thrilled at how much participation from communities in the South, because that was really the largest showing of communities in the South. Georgia especially has had a really large explosion of land bank activity across the state. There are now, I believe, over 20 land banks in the state of Georgia alone. If you go to the next slide, Stephen. So we work in communities that often look like this, where people are living on a block that may have one, may have two, or may have a majority of properties that are abandoned and may have been abandoned for a long time. Sometimes they're in some stage of mortgage foreclosure, sometimes they're in some stage of tax foreclosure, tax lien sale. And I'm going to talk briefly about the external costs. I'm going to blow through a lot of these slides relatively quickly because this is the type of slide deck that I wanted folks to have at their disposal to click through into some of the hyperlinks without necessarily going through in painstaking detail. So if you can go to the next slide. We can't talk about the work that we do without talking about the legacy of redlining and the structural and systemic racism that was built into our nation's housing policy. Most folks know what redlining is. Redlining, however, is not something in our history books. Redlining is still visible today. If you go to the next slide, Stephen. You can overlay, here is, that last slide was Kansas City, and here is a heat map based on reported data in Kansas City for code enforcement data, law enforcement, and police fire safety data, where the overlap of where most of this activity for dangerous buildings is, you can literally overlay historical Hulk maps and really see that those boundaries have not necessarily changed much. So the work that we do is steeped in an understanding and often bringing communities to a better understanding of the impact that this legacy has had on how their communities have developed and how how disinvestment has plagued their communities. Next slide. I'm going to blow through these relatively quickly. One example of a study in how do we quantify external costs of vacancy to a community was done in a report that we did around the city of Pittsburgh that Dan Immergluck, who's based in Georgia, who I know a lot of you know, worked with our National Technical Assistance team. Next slide. To really quantify what are the additional code enforcement costs, the additional police, fire, loss of tax revenue, property tax impact, and per property, you can break these costs down. And Dan and our team did an amazing job picking apart that data, which is helpful to communities in trying to get their community leadership to understand why it's important to build in interventions and keep properties from becoming vacant and keep owners from losing their properties because of the costs aren't just borne by those owners, the costs are borne by the entire community. Next slide. Again, this is another breakdown. They built in a range based on what a conservative estimate might be versus what, sort of a best reasonable estimate might be. And again, the costs are in the tens and hundreds of millions based on lost property value, lost property tax revenue. And so this isn't just something to do if you can, it's something, it is the amount of economic harm that disinvestment and vacancy can do to a community usually vastly outweighs the resources that communities tend to try and allocate towards vacancy and code enforcement. As we know, there are a lot of really difficult decisions being made in towns and counties because of how seriously the pandemic has impacted public finance and the public fisc. And often, unfortunately, code enforcement departments who are on the front lines of addressing problem properties and vacancy and abandonment are often the first departments to receive cuts. So again, these numbers can be helpful if in your communities or in the communities that you work, people are trying to grapple with where do we cut, knowing what we think we're heading into with a long economic calamity and recovery. Where does this, where do we need to allocate our resources? Next slide. And again, this is just another sort of overlay of looking at vacant properties and then looking at the dispatches that take longer than 10 minutes associated with these properties. So again, it's a very, very close overlap. And it's really pretty staggering to see how data analytical tools like maps like this can really show you that there is a direct causal relationship to the costs that municipalities spend and the problems that these properties bring. Next slide. Again, the benefits when we do address problem properties are reductions in crime, improved health, the impact to surrounding property values, even the impact that what can sometimes be seen as a small but impactful effort to have community involvement in vacant lots and greening them, planting community gardens, even just mowing the grass. It costs money and someone has to do it and someone has to take the time to do it, but it can have an impact on that community's health and that community's market health as well. And again, the costs to property tax revenue for municipalities and for their school districts. Next slide. Again, one thing that we think about when we're not just talking about the costs of these things that we quantified in the study around Pittsburgh, but what costs are there in when properties slip from occupied to vacant and then usually relatively quickly deteriorated from becoming vacant, the cost of losing other naturally occurring affordable housing opportunities in a lot of communities where we are experiencing an affordable housing crisis are another important cost component to think of. There was already crisis level housing affordability issues prior to this pandemic. And a study that I know a lot of people reference, and National Low Income Housing Coalition does an annual study called The Gap to explain sort of what the housing burden is nationally. And their most recent study published in March, again, prior to COVID-19, showed a shortage of 7 million affordable and available rental homes in the country. Next slide. There's a couple of federal legislative initiatives we've been involved with very heavily at the Center for Community Progress. The first is the Neighborhood Homes Investment Act, which has been introduced in both the House and the Senate. It's essentially a housing tax credit to incentivize the redevelopment of single-family homes. To fill the appraisal gap, which occurs in a lot of weaker markets, where the cost to acquire and then rehab a home to make it habitable and safe for a family would exceed the cost would exceed the price you could ultimately sell that home for. So the Neighborhood Homes Investment Act is designed to fill that gap so that it doesn't make right now it doesn't make economic sense to rehab completely rehabable, if that's a word, single-family homes in a lot of communities where that is the predominant housing stock. There are multifamily tools like the low-income housing tax credit that have been successful in a lot of communities in the multifamily space, but this would create sort of a single-family analog to that that has built into it controls around what census tracts qualify based on levels of median income, based on other housing market factors, to try and keep this from being utilized as a tool of gentrification and displacement. And the tax credit is predicated entirely on the ultimate disposition of that house that's rehabbed being to a family that meets income qualifications. The other initiative is the National Land Bank Network Act, which Congressman Dan Kildee from Michigan is one of our founders. He and Congressman Ferguson from the Atlanta suburbs introduced this piece of bipartisan legislation in the House that would provide federal funding to support a national network that Center for Community Progress is working to try and build to help land banks across the country learn from each other, get resources, get grant funding, because again, as we talked about with public budgets being cut, land banks are also struggling for financing and to not be cut out of local and county budgets. Next slide. One thing we might talk about in the discussion, and that our organization has been doing a lot of thinking about, and there are some blog entries which you can click through to one of them in this deck. We've created a code enforcement working group in our organization to talk about how the need for equitable code enforcement in this crisis, particularly in mom and pop landlords and the relationship in the local housing markets. Eviction moratoria don't help landlords who still have bills to pay. And without some type of rental assistance funding that can go to help clear rent arrearages that tenants who are taking advantage of the eviction moratoria are building, all it is doing is kicking the can down the road. And code enforcement is an important tool and a powerful tool, but we're trying to come up with ways where code enforcement can be done more equitably and can bring landlords and tenants to the table and help try and problem solve rather than just simply acting as yet another enforcement tool, instead trying to really meet people where they are and try and help struggling landlords who are just trying to make ends meet get resources to try and maintain their properties and keep them safe for tenants and for them to be safe and housed during this pandemic. Next slide. And that's pretty much it. So feel free to follow us, and I'm looking forward to a discussion. Thanks, Stephen.
Thank you very much. And while Rob was talking, we did post some local resources that parallel the Center for Community Progress's work, including a map for redlining for Winston-Salem, North Carolina, and Greensboro, North Carolina, overlaid with maps of race, ethnicity, poverty, and code enforcement. So some of those same things that Rob was pointing out with local implications. Next up, we have Lauren Lowry with the National League of Cities. And let me bring up your slide deck.
Thank you, Stephen. Thank you for inviting me to this Hangout. Very excited. Next slide. Hi, my name is Lauren Lowry, Program Director for Housing and Community Development at National League of Cities. National League of Cities is the voice of America's cities, towns, and villages, representing more than 2 million people across the country. Next slide. Our mission is to strengthen local leadership, influence federal policy, and drive innovative solutions. Next slide.
Here you go.
Our membership, we represent over 2,400 cities, towns, and villages across the United States, as well as 49 state municipal leagues. And although we don't have private nonprofits private and nonprofit organizations as our members. They participate as our partners and supporters. Next slide. Prior to COVID, National League of Cities provided a significant investment in our housing research and technical assistance. In 2018, we launched a national task force on housing with mayors and city council members across the United States representing different party afflictions. From that report, from that task force, we launched a report called Homeward Bound, The Road to Affordable Housing. There we produced a recommendation, not only what cities, towns, and villages should be doing, but at a federal level, how can cities, towns, and villages be working together. Also, last year, we produced a handful of reports about local tools to affordable housing that talked about housing and preemption, as well as we produced the housing market studies. And earlier this year, prior to COVID, we were investing a lot of our time and energy into ending housing instability and homelessness, but due to COVID, we've had to augment our work. Next slide. So the first step of augmenting our work, we partner with Bloomberg Philanthropy to produce a COVID local action policy tracker. To date, we have collected over 400 policies around housing instability and homelessness from cities across America. Next slide. From the tracking of those policies, we've seen a lot of good policies implemented. We've seen cities across the United States implement housing assistance, either in a combination of mortgage and rent, or rent and utilities and mortgage for residents affected by the COVID crisis. We've seen cities like San Antonio, Charlotte, North Carolina, Atlanta, Georgia, implement programs such as this. We've seen cities implement eviction mediation before eviction filing, cities like San Jose and Pittsburgh, Pennsylvania. We've seen cities like Chicago implement renter protections, where they've implemented an eviction protection ordinance that makes the landlord in good faith effort try everything that they need to do before filing an eviction. We've seen cities implement tax relief programs, and we've seen cities implement rental freezes. We've also seen cities work hand in hand with philanthropic organizations in the community to raise funding to ensure people remain housed. But as we've all learned over time, the CARES Act was not necessarily enough to stave off the current eviction cliff that we're dealing with. Next slide. What we've learned about the CARES Act is that the Corona Relief Fund, although $150 billion was allocated, only states and cities with a population over 500,000 were able to receive that funding. We also learned that with the CDBG funding, $2 billion went to cities with populations over $50,000, $1 billion went to states. Also, ESG only went to existing recipients. Knowing this information, National League of Cities quickly mobilized, next slide, and we launched our Cities Are Essential campaign. Through this campaign, cities aren't asking for a federal bailout. We're just asking for monies to help us to remain whole and able to tackle this crisis on the ground. Next slide. So with the goal of the Cities Are Essential campaign is $500 billion in direct flexible funding to all local governments. As stated, not all local governments received CARES Act funding. And so with that, we're asking for fair and direct funding to all cities, a distribution formula that follows CDBG, and with reserving 30% for municipalities below the 50,000 population, and funding funding eligible for a broad range of uses, including revenue shortfalls due to the coronavirus pandemic. We also support the $100 billion in emergency rental assistance as well. Next slide. And recently, as of June, National League of Cities conducted a survey of 1,100 municipalities across the United States. And here's some of the results. As of June, 24 cities had yet to announce if they plan to distribute federal relief to local governments. Nearly 70% of cities did not receive funding. 74% of cities have begun to make unavoidable cuts and adjustments. 20% said that cuts were happening across the board, and 54% were saying more targeted cuts. Next slide. And with those cuts, 24% of cities are cutting community and economic development program, which is very critical during this time to ensure that families remain stably housed. Also, during this time, 30% of cities are making necessary cuts to code inspection, planning, and permitting. And, during this time, National League of Cities, in tandem with the Cities Are Essential campaign, we've also deployed content to our members in the forms of blogs, webinars, and guidance as to what recommendations we can give to cities to act now. Currently, we have been deploying an eviction series. We know because of the eviction cliff, a lot of cities they were talking about evictions, but they were beginning to stand up or bolster their eviction program. So this eviction series is how to build the plane while the cliff is happening. So we're diving into how to build a just and fair anti-eviction strategy. We're diving into school mobility and evictions. We're looking at the data, as well as having communities to think about long-term interventions into mediation programs. In the midst of that, we also had a recent virtual summit that Stephen had an opportunity to participate on about leading an equitable response to eviction, where we talked about grounding racial equity into the response and putting people at the center and what communities should be looking for during that time. We've also launched a Housing is Health series. So as cities are thinking about how to respond to COVID, they're also taking a look at their current interventions and thinking about what it means for housing hazards. What does this mean for the homeless population, and looking plans overall to be implemented due to this crisis. And with the most recent orders from the CDC, we are quickly developing a guidance to speak to the lens of cities, how they are to react to the most recent orders and how they can continue to support their residents in their community. So looking at response, but trying to also lead with recovery as well. And I think that wraps up my presentation. Yes, for more information, you can find us at nationalleague.org, or to visit some of those resources. I'll definitely drop that in the chat box. Please go to covid19.nlc.org. Thank you.
Thank you, Lauren. Next up, we have Emily Dowdle from Reinvestment Fund, and I will pull up your slides. I have too many windows open. There we go. Emily?
Oh, and now I'm muted. Hello, everybody. It's great to be here this afternoon with all of you. Thank you so much for taking the time to listen to us. And really, I'm very impressed by those previous presentations. So hopefully, they're a tough act to follow. But I think I've got some new information for you. So, I'm a huge data nerd. I love data, but I really do love cities and communities more than the data, not data for data's sake. And I think everyone on our team has been really focused on trying to do our best at pulling the data available to help people who need to make policy decisions and spending decisions really quickly right now as they respond to the crisis, the interrelated crises across the country resulting from the pandemic and previous long-standing difficulties. And so we're trying to use this data in ways that we can get it out, turn it around quickly. So sometimes it's a little messier and less precise than we normally would like, but we want to be as helpful as we can and really make immediate changes and decisions. So Reinvestment Fund is a community development financial institution. We create opportunity for underserved people and places through partnerships, and we do that through capital, analytics, and general expertise, all in support of healthy, strong, and equitable communities. Although the main business of Reinvestment Fund is lending for things like affordable housing and grocery stores and daycare centers, we do have a few teams that really make us stand out, I think, from other sorts of CDFIs out there, which is that we have the Policy Solutions team, which has expertise in things like residential market conditions, equitable development policy, fair housing, mortgage foreclosures, evictions, food access, and arts and culture. We've been really focused on evictions in Philadelphia specifically since about 2016, when we were supporting the city's assessment of fair housing. And we saw some really troubling patterns that then we've been able to explore further in a continuing way. And Jennifer, my colleague, will tell you about her program work when it gets to her portion of the presentation. So again, we wanted to figure out quick ways that we could get a sort of general sense of the impact of the pandemic. And one way that we wanted to do that was looking at, we were in conversations with the Pennsylvania Housing Finance Agency, who wanted to understand how much of an increase they were likely to see in applications to their to the homeowners emergency mortgage assistance program. And be sort of prepared and get ready to go to the legislature to get more money on hand to be able to put it out into communities across the Commonwealth once those applications came in. So what we did was that we looked at the relationship between unemployment over time and applications to HEMAP over time. So this is the chart of unemployment from 2000 to 2020 without the most updated numbers, but we know it's far above what it was in the worst days of 2009, 2010 in Pennsylvania. Then we combine that with HEMAP applications, that highlighted gray area on this. Oh, I'm sorry, can you go one more slide? So the highlighted gray area here is the middle of the crisis period, and you can see there was a point at which they shut down the program. That's what that cliff is. It wasn't that nobody needed help with their mortgage. It was that there were too many applications to respond to the demand, and they actually had to pause, and they had to lobby the legislature to recapitalize the program. And so once they got that back off the ground, it was after the worst part of the crisis, but there was still a lot of homeownership instability in many communities in Pennsylvania, but it did sort of tail off there in recent years. So when we did a regression analysis, we found that, next slide please, we found that for each 1% increase in the unemployment rate in Pennsylvania, there were an estimated 384 additional HEMAP applications filed per quarter, and that was a statistically significant result. Now also let me step back a minute and explain a little about HEMAP. It is a low interest loan program, so homeowners who take advantage of it do have to pay it back, and so the returned money does help to keep the pool of money available for other Pennsylvanians. But obviously a problem is that the money doesn't necessarily flow back into the program at the same time that demand is increasing for assistance. So there isn't always necessarily enough to meet demand. And homeowners have to show, or have in the past had to show, that they're unable to pay their mortgage through no fault of their own. Typically it is unemployment that drives these applications, but it could be a medical issue or something like that. All right, next slide. I'm also trying to blow through these pretty quickly because I know it's already been a long hour and we still have another panelist, so I'm going to do my best. So this is what we projected for the increase in HEMAP applications that the Housing Finance Agency might expect to see with different unemployment scenarios. So and this is quarterly, not annually. So if unemployment went up, hit 10%, it would be almost 3,000 more applications. And then if it was up to 30%, it would be 10,000 more applications per quarter. At just that 20% level in the middle of those projections we made, that would exceed all post-2000 HEMAP history. So that would be way beyond what we saw in the last housing crisis. And so, yes, PHFA was very right to be concerned about what we think are going to be a lot of applications. Of course, many of the programs that Sidra outlined are helping to reduce that number of applications as people are getting assistance directly from their lenders or the backers of those loans. All right, next slide. All right, so that was our quick look at homeowner impacts. We've also been trying to understand what the impact is. Oh, I'm sorry, I'm talking too fast. I can also, does anybody want to ask any questions about those, or receiving questions till the end?
Keeping a stack of questions for the end. Yep.
Okay.
Yep. And we are recording, so this will go up on the website.
Okay, great. Thanks, Stephen. So understanding the impact on renters. This was, we first started doing this when Regional Housing Legal Services came to us. They're an organization that works statewide in Pennsylvania. They've got offices in the Philly area and Pittsburgh and Harrisburg. And they wanted to go to the state and lobby hard for getting some of the CARES Act money assigned to rental assistance. And they wanted to have some estimate of how much need there would be on rental assistance. So next slide. I think the other direction, yeah. So in order to get enough resources, we really need to understand what the financial impact would be of COVID-19 on people's ability to pay their rent. So we started with a baseline of what the pre-COVID levels of cost burden were. Obviously, many households were already struggling to pay on a regular basis. And then if you hypothetically impair renters' incomes at different levels, what will the resulting cost burdens look like? And we did that because we understood that unemployment might be someone losing one of their 3 jobs, 2 of their 3 jobs, or it might mean, a reduction in hours at their job, or it might mean a pay cut. So we wanted to be sort of take a general approach to overall how much income might be reduced versus, complete unemployment. And knowing that the different federal programs were supplying some money to some folks, including some people getting more money than they actually had earned. So we made this very general. So given that level of income impairment, what would the aggregate difference be in the funds needed to get people back to where they were before the pandemic? Recognizing that, of course, many people were already struggling. But what was that difference between the old gap and the new projected gap? And theoretically, that is something that, a gap that would need to be filled with assistance. Okay, next slide. So the bars on the left show, and everyone else keeps mentioning Pittsburgh too. So, a good thing I have this Allegheny County example in here. So this is Allegheny County in Pennsylvania, which includes Pittsburgh as well as many other communities. And the shortfall before COVID for people making under $20,000 was $23 million a month, which is really staggering already. that was the difference between what people could afford to pay and what people were paying for their housing. For people in the $20,000 to $50,000 range, it was $10 million a month. For $50,000 to $90,000, $100,000, it was much less, because people are less cost burdened as you go up the income scale. And then you can see in the middle set of columns and then the far right set of columns, just how much the burden increased for those different groups. And of course, the largest number of people burdened always are in that under $20,000 group, people who need deeply affordable housing. All right. Okay, thank you. And so in Allegheny County, we found that the impact was from $2.5 to $5.6 million for households with incomes from $20,000 to $100,000. That was the new rent gap for those households. And for all of the households, including those under 20,000, that grew to from 3.7 to $7.9 million. And that again is just a monthly rent gap that would get people back to their already burdened state before. But this was sort of, if the Pennsylvania state legislature is looking to get money to folks in local government, that local governments have a hugely vast gap they're looking at right now. And landlords have a hugely vast gap in what they're going to be able to collect. And tenants have this huge gap in what they're going to be able to pay. It's impacting everybody. All right, next slide. So we've been studying eviction filings, as I mentioned, and this was the trend before the pandemic. There had been around 22,000 filings a year until 2014, and then they started coming down. 2014 is also the year that Pennsylvania expanded access to Medicaid. And after that, in Philadelphia, the share of residents that were uninsured went down every year since 2014. Unemployment was also going down in the city at this time among people of all different income ranges. So we really think that it had a lot to do with the economic landscape, as well as access to medical insurance that was helping to bring these down, as well as increased city attention on evictions and new guidance, new rules around the requirement that landlords have an active license in order to evict. That hadn't been enforced before. Now it is, and they also have to have a certificate of rental suitability before they can file. So we think all of those things brought it down. But as those were the contributing factors to bringing eviction rates down, we now know that all of those things have been reversed, and we expect the eviction rate to climb once the moratorium is lifted. We had a local moratorium until August 31st. They tried to open court for one day yesterday, and I guess there were protests, but some cases proceeded. But now things are going to close down again, or may close down again entirely with the CDC. It's unclear what's going to happen, given that almost every renter in eviction court in Philadelphia earns less than $100,000. Next slide. So in our research, we found that there was this persistent and statistically significant effect of tract level racial composition on filing volume, and that was independent of income, of tenure mix, and of concentrations of public housing. So income absolutely influences eviction, so does the presence of renters, and so does the presence of public housing in Philadelphia. But race was always there as a very significant factor, and so we found that evictions were higher in middle and upper middle income Black neighborhoods as well. It was also interestingly lower in many of the most predominantly Hispanic neighborhoods in Philadelphia. And part of, we think, we did a lot of interviews to try and understand why. And we think that has a lot to do with the use of family and friend networks to find housing in these Hispanic communities. And the fact that sort of if an issue comes up, it's resolved informally, and also these neighborhoods have a long time been sort of distrustful of the city and the courts, and so problems are resolved informally and outside of the traditional legal system. There's also a lot of unlicensed rentals in those neighborhoods, so landlords there wouldn't be able to evict without going through the process of getting a license. Okay, next slide. So we also wanted to look at how COVID-19 lined up with eviction rates. So the city of Philadelphia passed emergency housing legislation in May, which included a suite of bills, and the landlord association sued them in court, and we put together some maps for the city as part of an affidavit to help them defend the legislation. They did win. The city prevailed over the injunction, so it's going forward. We found some really interesting things, including that, you know, in areas with the lowest COVID-19 hospitalization rates, the typical zip code has an eviction rate of just 1.4%. And by comparison, the typical eviction rates in areas with high hospitalization rates was 6.5 times higher at 9.1%. The data also show that areas at elevated levels of economic risk, according to an analysis by the Federal Reserve Bank in Philadelphia, those areas were home to substantially greater shares of Black and Hispanic renters compared to areas with lesser economic risk. For example, the percent of renters who are Black is 20% in the low economic risk areas and 48% in the highest economic risk areas. Oh, I'm sorry, this is, next slide, please. Now I'm talking about this slide. I'm trying to have my own slides and your slides. So here you can see where that job risk is, and you can see that it does fill in a lot of those Hispanic areas that don't have high official eviction filing rates, but we think there are a lot of informal evictions that happen there. And these are jobs that have been disproportionately affected by the pandemic shutdowns. Okay, next, okay, yes, the slide. So then these are areas, again, that were identified by the Fed researchers that are at high economic risk. So big risk of job loss, and then also have high hospitalization rates for COVID. So again, we saw a lot of overlap here, especially in the sort of upper North Philadelphia and lower Northeast and Southwest Philadelphia. So this helped us make the case to the courts that, in fact, the city is absolutely justified in pursuing all of these emergency housing policies, which include pre-filing diversion, mandatory repayment in up to 9 months. So tenants have up to 9 months to pay back rent, and also suspending all late fees. All right, so next slide. And I'll just go right to the next slide. So this is about what to do about it. So, you know, we were really happy to be part of making the case to the legislature. There should be rental assistance in Pennsylvania. But unfortunately, the rules they set for it mean that a lot of people have not been able to take advantage of it. So there was a $750 cap on rent, which doesn't cover rent in many parts of the state. And especially does not cover rent in family-sized units. There was a requirement that tenants had to be 30 days past due, and many tenants had sort of been doing their very best to keep current, and they were worried about what not paying might do to their record. And then finally, there were restrictions on late fees and eviction that extended beyond the moratorium period. That discouraged landlords from approving the request. So in Philadelphia, 2/3 of people who applied, of more than 10,000 who applied, couldn't actually move forward because their landlords would not agree to participate. So housing advocates in the state right now are working with the legislature to try and change the rules. So again, you know, we're sort of working in real time trying to change the policies to actually get the help out there. All right, next slide. And so just quickly, we have studied the impact of Philadelphia's foreclosure diversion program. that was put in place in the last housing crisis and was really successful, and some other communities modeled programs after it. And we are hoping that the Philadelphia eviction diversion program can be modeled off of it in some way. So in that program, we found that 65 to 70% of all eligible homeowners did participate. And of those who participated, 30% reached some form of agreement. And of those who reached an agreement, more than 85% were still in their homes approximately 2 years later. So next slide. Obviously, evictions, rentals, and homeownership units are very different. But we do think some of the themes that apply are that not everything requires legislation. It's great that the city passed this new program requirement, but administrative actions can also allow for a lot of evolution of practice. You can't underestimate the importance of leadership and building trust among different stakeholders in the legal system, and in the landlord community, in the tenant community, in the legal community. And also the appropriateness of the resources is so essential. So a big part of the success of foreclosure diversion was counselors who worked with the homeowners ahead of any discussion to get them to understand what type of payment they actually could afford to make, and make sure that they were accessing any of the financial assistance that was out there available to them. And that is important to tenants as well. Because we know tenants from interviews will just sort of be inclined to agree to anything because they think it'll buy them some time. And counselors can help people come to an actually realistic repayment plan. And then finally, counselors can do a bulk of the work. We need funding for those counselors, but they are generally cheaper than lawyers. But having lawyers available for more complex cases is also really important. All right, next slide. And that's it for me. Oops, I left Ira's email on there. Oh my goodness. You can figure that my email out from that. It's emily.dowell@Reinvestment Fund. And I'll turn it over to Jennifer now.
Great. Thanks so much, Emily. Hi, everyone. I'm happy to participate today in this important discussion. Since my colleague Emily already described our organization and its impact on housing policy, I'll just add that from a program side, our focus connected to this work is in making mindset shifts, both for policymakers and influencers, working with cities on approaching community development in low wealth communities with an equity mindset related to those policies and practices. Next slide. Oh, wait, you're already on it. You're fine. So Reinvestment Fund has a longstanding partnership with the Robert Wood Johnson Foundation to build a culture of health through several program initiatives. And as Director of Program Initiatives, I lead the development and implementation efforts on both the Building Healthier, More Equitable Communities Initiative in New Jersey and the National Invest Health Initiative, both focused on more equitably improving the conditions where people live through community development, such as safe, affordable housing, healthy food retail, and changing the systems that create barriers to more equitable community investments. So this work is so critical because unfortunately where we live matters until our zip codes no longer impact our life expectancy. Next slide. So as background, in early 2016, in partnership with RWJF, Reinvestment Fund launched Invest Health as an initiative that was an innovative forum for 50 small to mid-sized cities to define community needs and investment challenges, devise solutions, and align investment capital, other resources, and policies to improve the social determinants of health. So the 50 cross-sector teams comprised of 5 leaders from the public, private, and nonprofit sectors participated, and that included government, community development, and health representatives. And in addition to a modest grant, each city participating also attended convenings and received technical and coaching assistance for 18 months. They also collaborated across cities to share learnings and participate in site visits to model other work through an additional competitive grant opportunity that was provided, and many of them took us up on that. Next slide. So the Invest Health journey has been continuing, and we've been very fortunate with that. And in the second phase of the work, 10 of the original 50 cities were selected as Invest Health field building cities. They built on the initial learnings from the 50 city cohort, related to connecting health and community development equity for a mindset shift, building a strong collaborative infrastructure across sectors, advancing a pipeline of built environment projects that address the social determinants of health and affect equity and well-being, creating an enabling environment of systems, policies, and practices that advance equity, and also identifying new capital streams into the community investment system, and finally, building a network of relationships across cities and teams. For field building, they focused intentionally on advancing their pipeline and systems change work, and 9 out of 10 were primarily focused on affordable housing, so very relevant to the discussion. Go ahead, next slide. So as an adaptation of the National Invest Health work, the Building Healthier, More Equitable Communities, also known as BEC, launched in March 1st, actually. The timing, although on face value might not sound like good timing, given really the COVID pandemic was really just gearing up then. The timing may actually be favorable, though, for the cities that will be engaged, and that resources for recovery could be well aligned with this work. BEC is aiming to address the social determinants of health through built environment and community investment system improvements over 3 years, which is a lengthier time than the Invest Health initiative had started out. And in the next 2 months, we'll be selecting the 4 cities out of the 10 that were eligible to participate as cross-sector collaboratives, working towards more equitable recovery and project advancement in the communities that they work in. The 4 cities are going to have access to development-related support, pre-development funds, and flexible financing. And additionally, data analytics and technical assistance will also be available. When we were planning that work initially, we collaborated with our colleagues in the Policy Solutions Department at Reinvestment Fund on Emily's team. And so we look forward to doing that further in the next phase of this work for the implementation. Next slide. So an important element of BEC is that we are specifically focused on leveraging the fact that these 4 cities will be sharing a single state policy environment. This is relevant in that the advisory committee for BEC is comprised of statewide organizational leaders, many of which are either from government agencies or policy advocacy networks. So housing, evictions, homeowner issues, and mortgages are all going to be front and center in the work that we do, because as the intervention starts later this fall, folks will have their eye on recovery, and these are going to be challenges that we're going to need to tackle. So this also just shows some of the objectives for BEC regarding identifying shared priorities, deepening understanding across sectors, strengthening those partnerships that they already have, building that capacity further, facilitating resource alignment, and also improving systems that may currently create barriers to improving the health and well-being in communities. Next slide. So across both initiatives, both BEC and Invest Health, there are several COVID-related challenges that folks had described at any given point. And of course, the housing stability, eviction, affordability, as well as homelessness services, housing and supports were kind of top of the list, maybe just right below the immediate needs of food access. And you know, the pandemic required a pivot for our work to create a more open forum, definitely for our field building learning community, so that they could share ideas, challenges, and resources through virtual convenings. And several housing related and policy oriented innovations and tools were shared throughout the community, which was very helpful. And Stephen could probably attest to that a bit in some of those virtual convenings. You know, these opportunities to express lessons learned as well as solutions were really important for the group to continue to get through this time together and share what learnings they have throughout that process. Now, for building healthier, more equitable communities in New Jersey, we'd be remiss not to consider the impacts of the current health and economic crisis on the capacity of these collaboratives we're planning to engage with, as well as work priorities. So we took the time to ask folks, you know, what the biggest challenges they were experiencing currently related to the pandemic on their work, and what the needs would be moving forward, because that would be very helpful in us making sure that we co-design and meet the needs of those cities as they proceed from relief to recovery efforts. and then hopefully implementation of what their priorities originally were, but better. So next slide. I wanted to give just a couple examples of some things happening in some of the Invest Health national cities. In Napa, California, I actually took that picture. This was right after the fires, and you could see that kind of in the middle of all the green that had newly grown from the black charred landscape, there's just a place where a home used to be, and all you see is, you know, the concrete at the base, and that was a standard picture throughout that community. So you can imagine all the hardships that are happening now with already having an affordability crisis and this continuing. So what I'm hearing from Napa is that even though rental rates have softened, probably due mostly to job loss and businesses closed, you know, they're still needing some anti-eviction ordinances and regulations being adopted, as well as establishing local rental assistance programs. They are seeing that home prices are up and the inventory is down. So they're trying to address that with first-time homeowner programs to assist low-income buyers. Next slide. So in Riverside, California, again, you're gonna hear a lot about rental assistance, grants, temporary moratoriums on rental evictions, homeowners receiving foreclosure intervention counseling by some of our Invest Health city representatives. The Small Business Emergency Microgrant Stabilization Program was just approved by their city council and will leverage funds in order to help with the community development block grant effort, and then impacting many hundreds of small businesses that have just a small amount of employees and are also owned and operated by low to moderate income individuals. Next slide. So in Grand Rapids, in April, they were already having a 30% delinquency rate in rent. Rental assistance program was developed with a $50,000 contribution from Link Up, one of the Invest Health team members. And of course, anti-eviction ordinances were also adopted. Next slide. And interestingly, in Missoula, Montana, the city was in process of purchasing a hotel, initially for temporary safe shelter for COVID quarantining, but eventually going to turn it into affordable housing with wraparound services, including social work. Next slide. So in Spokane, Washington, the non-payment of rent continues to be an issue, and I think several other panelists mentioned the issue. It's you know, beyond just the rent, but then some of the small mom and pop landlords also have mortgages to pay on top of that. So it's a big mess. There are some funds that are available to help with eviction prevention there, but they have just such a magnitude of need, really eclipses it by 20-fold, whatever assistance is there. The availability, nobody's moving right now there, and so there's a less than 2% vacancy rate. And then really at the end of the day, it's going to be, you know, policy is important, but funds are going to be needed to address the issues that are happening in Spokane. Next slide. So when we think about what's next related to program initiatives and how we connect to cities, we're going to continue to connect our Invest Health cities and keep them connected with each other to share short and long-term recovery solutions. We think this is a great way to help allow cities to bring each other along and share lessons learned. We're also going to explore how state and federal resources can best align through these recovery efforts and beyond with our Building Healthier, More Equitable Communities initiative. Next slide. So thank you. There's my contact information. Thanks for having me.
Thank you so much, Jennifer. We're going to open it up now to questions. We do have quite a few that are already in the stack. The first question is from Sheena Beasley to Sidra, and there's 3 parts. First, what is a lender letter? Are delinquencies reported during this period? And then what is an MBS trust?
Sure. So a lender letter is our way of communicating our policy changes or temporary policy changes. So if you go to the fanniemae.com website and you click on the selling and servicing guides, you can see all I believe it's 8 policy guidance issuances related to COVID-19. It's probably in total close to 100 pages of information. So if you really want to get into the weeds. What was the second question? I apologize.
Are delinquencies being reported during this period?
So, I mean, that's a very complicated issue. Servicers and lenders are supposed to be following the CARES Act. And so the CARES Act says that if the loan was current in the time of the disaster declaration, it has to continue to report it as current. So there's not a simple answer there. And then the last question, I believe, was related to what's a mortgage-backed security. So what we do at Fannie Mae is we take pools of loans, and when I say pools, thousands and thousands of loans, and package them into what we call mortgage-backed securities. And that is purchased by institutional investors like insurance companies, whomever. And that is how we sort of structure it. We actually retain very few mortgages on our portfolio and actually are capped by our regulator. But that's sort of, if you've seen The Big Short or, moved or read the book, it talks about, what is a mortgage-backed security in a lot more fun detail than I can describe here.
Eureka Thornton had a question also for Sidra. Do the foreclosure delays apply to all types of loans like FHA, conventional, et cetera?
So our foreclosure moratorium applies just to the loans that we own or guarantee, or put in those mortgage-backed securities. Freddie Mac, who's our counterpart, also we have an aligned policy, and I have to admit I don't know what FHA's policy is.
And then that wouldn't affect, for example, local banks or credit
No.
unions that hold their portfolios locally.
Right. Yep. Exactly.
I'll just jump in, Stephen.
Yeah.
I'm going to post in the chat. The Consumer Financial Protection Bureau has been working to try and create a one-stop shop as close as can be for information about housing and programs related to COVID-19. So I'll send that link in because there are all kinds of different regulators and insurers involved. FHA, Sidra can't speak on behalf of FHA or the VA or the USDA, but CFPB is trying to, your results may vary, but is trying to keep sort of information. It's my understanding that FHA, USDA, and VA have also followed suit with respect to the foreclosure moratoria, but CFPB's page should have more information about that.
Thank you, Rob. Rob, the next question is for you. Tammy Dixon asked, is anyone else concerned the most recent eviction moratorium was issued by the CDC as opposed to HUD?
So yeah, it's kind of uncharted territory here to have it's technically the CDC through Health and Human Services is really the agency. And the answer is we'll see. I think this is going to have a lot of implications that legal services attorneys who represent tenants are still trying to wrap their brains around how this gets operationalized. I know, no one I know who follows a lot of policy conversations knew that this was in the works. And so we're still in the process of really trying to understand. One thing that I will also add into the chat is my go-to for trying to understand what this really means to tenants is generally the National Housing Law Project. And they've issued some information, some preliminary analysis of it, and they're going to be updating that with more information. So the extent to which this is really going to be something that tenants can use as a defense to eviction, well, I think they're at the forefront of examining. But one thing with respect to the this week's broad eviction moratorium issued by CDC, Health and Human Services, to keep in mind is it's only applicable in areas that don't already have an eviction moratorium in place, either state or locally. So understanding what your local government and or state government's eviction moratorium is or may be is important to to note, so that you're following the right path and the right guidance. And again, if those expire at the end of September, then I think presumably the CDC moratorium that is in place until December 31st will then kick in. But it's a lot to navigate and a lot to try and understand. I imagine we could spend all of the rest of the next time that we have together just trying to think out loud about it. But a lot of people are working really hard to try and figure it out too.
Also, I will add great points, Rob, that it did not provide aid to renters. I mean, and renters are still responsible for paying rent after this order expires. So there is still a lot, like Rob was saying, for us to wrap our heads around, and who's missing, and what gaps do cities, towns, and villages need to fill, as well as a community-based organization. So still a lot to understand.
Thank you for uplifting that, Lauren, and to some of the comments that I saw in the chat box as well. One thing that this agency guidance does not provide is that the CARES Act did provide in the limited context for which it did have an eviction moratorium was it doesn't prohibit landlords from charging any penalties, interest, or late fees during the period of the moratorium, whereas this does, which will only make the impact so much more devastating when those bills come due after this moratorium, because they won't just be the back rent. They will be able to impose late fees and penalties on top of that, and use those as a basis for eviction.
Still lots to figure out there in the kind of patchwork quilt that we see from state to state and even municipality to municipality, and how they're responding with assistance. From Sheena Beasley to Rob, who owns land banks?
That is a great question. Don't let the word bank fool you. And in some states, land banks actually can't be called land banks because there are strict state laws about what can be and cannot be called a bank. So a land bank is not a financial institution. In those states, they're typically called land reutilization authorities instead of land banks. We use the term bank, meaning it is a repository of land, and whether that land has a structure on it or not, it operates to receive land that goes through typically the property tax foreclosure process. So most land banks, as we know them, and as we would sort of, if we were an accreditation body, if we were in the business of accrediting land banks, they typically have to be either government entities, or people hate the term quasi-government entities, but in some states they really are, because they have to be formed. Often they're formed by one or more local governments as a nonprofit corporation pursuant to that state's laws. So it's a nonprofit that was created by either the city of Atlanta or the city of Atlanta and Fulton County to operate within that jurisdiction, to be this, the word I really like to use is steward, to really steward this land and make sure that the decisions that about the future of that land are made in line with community goals and priorities. So it is not, although anyone can go out and call themselves a land bank, like on paper, for profit, whatever, we don't, what we consider as land banks, and when we give tallies about the nearly 200 land banks that have formed around the country, what we're talking about is entities that were formed by governments and are either exclusively government agencies or nonprofits created by government agencies to affect this public purpose about who controls this land. I hope that answered the question. It is a really good question and not the easiest question to answer.
Dan Curry, I see that you're online. Are you able to answer that question as in the local context? You just turned off your camera a second ago.
Sorry, Stephen, I had to step away, so I did not hear the
No worries.
question.
I was just wondering if locally you had any insight on land banking. I understand that the state of North Carolina has a little bit more restrictive environment, and some counties and municipalities operate repositories, but not quite the same as a land bank. Is that true?
I believe that is the case, yes. But I don't have any specific knowledge of that right now,
Yeah.
sorry.
And I don't see our folks from the city or I'm looking for Cindy Blue or Stan Wilson. They're not here today.
Right. You know, there are other options. I mean, you know, obviously some communities have formal commissions set up, like Greensboro still operates the redevelopment commission, and it is a form of land banking, and other nonprofits that have those similar functions. So there's a lot of ways to go at that issue.
Yeah. Our biggest complication is clearing tax liabilities for resale, I think.
Right.
Tammy Dixon has a question. When Lauren was speaking, is there a direct correlation between cities' essential data around funding and the loss of jobs out of service and hospitality industry?
No, this survey took a look at city budgets to respond to the need of the COVID pandemic. So more so looking at city services and what cuts were being made in real time to really shore up things like rental assistant programs, PPE, utility assistance, and things like that. So more so looking at how city governments were responding to the COVID crisis.
Thank you, Lauren. Sheena Beasley had a question when Emily was speaking about how much have you reinvested or assisted homeowners and renters?
So reinvestment fund doesn't directly do consumer lending, so we don't do mortgage or rental assistance. We do financing for affordable housing. So we financed, I think, close to 25,000 units over our history. Many of those are rental units. Many of those are units that are project-based Section 8 or are also LIHTC housing. So a lot of rental low-income housing in Philadelphia and all over the country as well.
Just locally, 176 units were helped with a loan here in Greensboro, North Carolina, in rehabbing a property in our first Invest Health initiative. And I don't have any more questions in the stack. Does anybody have questions? If you want to unmute and ask them, we invite you to do so. I do see that Rob has posted some additional links to information about the moratorium and federal mortgage and housing assistance programs. Those should be quite helpful to those of you who are assisting residents who are facing eviction or foreclosure, or if you're facing that yourself.
I also, while Lauren was giving her presentation, I included the link to the COVID tracker, and I just wanted to give a shout out to how incredibly useful a tool that is, particularly in understanding what's going on in different jurisdictions around the country. I know from my own work, having worked in city government as well, some folks sort of know who their sister cities are in other places based on sort of size and demographics and economic and housing market factors. So I would always look to resources in, to see how, when I worked for Washington, D.C., how does Denver do this, or how does Boston do this? Because there are a lot of similarities and structural analogies that one could make. So the COVID tracker that they've been working on and updating in real time has been really useful. So encourage people to dig through that. It's a lot to dig through, but definitely do it. You can sort by columns. It's really cool.
I wanted to add that Reinvestment Fund Policy Map also has a well-documented, mapped COVID, I believe it's month by month layers, which you can then overlay with ACS data, health data, other types of data. Very useful tool for those of us who are looking at the geography of inequality. Had a comment from Robin Lane. Can you suggest resources to engage community members who are interested but don't know much about the technical issues of housing and affordable housing?
Thank you, Rob, for shouting out the local action policy tracker. Yes, I just dropped into the chat a study from Providence, Rhode Island called From Community Engagement to Community Ownership, and it talks about collaborative governance as well as racial equity. I find this document very useful, and it has a handful of case studies of cities around the community. So this is one. This was more so on Providence, Rhode Island climate justice plan. So if you haven't had the opportunity, I would read that. It really shows how cities can work with the community to really put forth resources and get them involved in the broader community development space.
I also earlier dropped in the chat Affordable and Healthy Homes in North Carolina, a white paper that I wrote for the Blue Cross Blue Shield Foundation. And I believe I saw Marianne Speroni on here a moment ago. She wrote a white paper for the same release, Investment Vehicles for Affordable Housing in North Carolina. And in both of those, we define different types of housing, the continuum of shelter and housing, and then some suggestions like CLTs or community land trusts and other shared equity models for creating more affordable housing. So some policy recommendations, and then in her paper, some very specific ways of investing locally given North Carolina's policy climate for housing need. Do we have other questions?
Just in talking about the community leader and community engagement question, I'm going to put in a link in the chat box to Community Progress has created a program that's it's a fellowship program for local community leaders. That's I believe we've done a couple of years in a row now. This year is a little weird because of COVID-19 and we're doing everything virtually, but the way the program works is that communities apply and nominate local community leaders to be considered for to be fellows, and a cohort of 3 cities are chosen every year. And it's a way for community leaders in different parts of the country and in different types of cities to do peer-to-peer learning exchanges, and actually, when we're not in the midst of what we're in the midst now, travel to each other's cities, walk the streets, understand where they have similar challenges and what ways their communities go about trying to engage local leadership and rally community support. So it's just a really great program. We have sponsorship for it, so the folks that are selected for each cohort are, their travel is funded, and so it's a really great opportunity. So I'll put that in as well. For I think there probably won't be applications for next year's until sometime, I think, in the spring, but something for folks in your communities to think about.
We've actually applied twice. We're working on getting through. It's kind of like that Fannie Mae challenge, actually. It took us 3 rounds, but we eventually got in on one of those, but yeah. And
it's one of those things where we've only done it a couple of times, and even the first year, there was such an amazing and strong pool of applications. You think for a program starting out new, it takes some time to build, but we've been really fortunate and really overwhelmed with how many applications we've gotten. So
Paula has a great question, and this is really for any and all of the panelists, because there's so many different ways to think about this. What is the actual definition of affordable housing?
Well, the typical definition is spending no more than 30% of your income on your housing. So affordable changes with your income. But there's lots of thinking about how that's not quite an adequate definition, because 30% of 20,000 still doesn't leave you with a whole lot for food and other expenses. So I think that's a conversation folks are having. You know, we keep finding that area median income is often used to set rents for what's so-called affordable housing and what can get funding from federal and state sources. But in Philadelphia, for example, the area median income is equal to about 60% of the city's median income. And so things that are, and essentially housing that's built for incomes that are at 80% of the area median income are actually unaffordable, more than 30% of income for more than half the city.
I just dropped again in the chat. Urban Institute just did a study for North Carolina just a couple of months ago, June 2020, in which we wrestled with the same definition. The advisory team was thinking, how do we compare a Charlotte, North Carolina to a Raleigh-Durham, North Carolina to Asheville or Boone? And we thought in terms of quintiles. What are the housing needs and the housing stock available? Very similar to using area median income for each of the areas in comparison. It showed that there were over 700,000 families that were cost burdened in the lowest quintile, and that figure has now been picked up as those who are most at risk of eviction. If you're in that lowest income category, you're by definition fitting poverty standards, you're cost burdened, and at highest risk of displacement. And I see, looking in the chat to see if there are any other questions. Does anybody else have anything that they'd like to ask our panelists?
If it's okay, Stephen, I just wanted to, I noticed that Robin Lane had commented about the Medicaid expansion in North Carolina, and I want to just really, really appreciate in Emily's presentation the analysis that they did, and because I feel like the field has gotten so much better even in the last decade, but it's so easy to just look at housing in this one sort of economic silo. And understanding how important an impact the Medicaid expansion can have on, you know, the overall economic health of a family who's renting and what they have at their disposal to go towards living costs. Not enough. I feel like not enough people are doing that type of analysis, and it's important to have conversations about housing in the context of health, and in the context of education, and in the context of you know, transit access, and just the field has really done a lot over the last decade to move into a more sort of interdisciplinary approach. But yes, we need to be talking about that and talking to policymakers about the, you know, the Medicaid expansion isn't just about healthcare. It's about everything related to a family's health, economic health, and otherwise.
Excellent point. Miriam asks about the rules of renting, that you must make 3 times rent to qualify, and if that rule could be overturned. I understand that that's more of a practice or business practice by different landlords or property management agencies. There's not a set law around income to rent ratios. Are there any policies in any specific places that address that? I'm sure that practice is also different depending on the local market. California market versus a North Carolina market may have a different ratio that
I will say this, as it relates to tenant protection, one of the things that this crisis did is made more cities pay attention to tenant protections, and how can we shape that going forward in working with our state legislators. So that's one thing I think, if everyone can take something away from that, how can we engage with your local governments and your state legislators to really put into place tenant protections after this crisis?
I also think it's such a complicated formula, this official but unofficial definition or rule, really, because on the one hand, I think when looking at trying to create affordable housing and to drive affordable housing and work backwards from what that affordable housing rental rate should be, I think it's important to look at the 30% rule. And again, the rule, not a law, but a rule, because there is so little, the market doesn't fix this on its own. And the market has not been able to fix this on its own. And so, I feel like there are benefits and burdens to all the different ways we look at this equation with what the right amount of a percentage of an income is for affordable housing, because I think in all too many places, the reality is that families have to spend 50% or more of their income to stay alive and to stay stably housed. And again, I'd reference that that NLIHC annual report that really digs deep into understanding in each state what the rent burden is and what the cost of living is versus the minimum wage rates and all of those things. So it's, I think on the one hand, we want to create more housing at rates that someone making 60% or even 40% of the area median income could afford, and we have to look at it in all kinds of different directions.
Thank you.
And I dropped in an example of what the city of Rochester did recently as to how they defined as a city what affordable housing meant for their locality.
Thank you. Well, as we come up on the hour, I want to offer to each of the panelists just a moment if they have any closing statements, remarks, suggestions, anything that they'd like to add before we say goodbye. Nope.
I guess I'll add, working in local government, being a resident of multiple cities, and now working at National League of Cities. I want to encourage everyone to begin working with their municipality, to get engaged, to really pay attention to the housing policies that are being passed, that they have people at the center of it, as well as being engaged with their state legislator to think about the tenant protections that are out there and what it means for developing affordable housing, and just being collaborative with your cities, towns, and villages.
That is a great suggestion. Right now we have a 10-year proposed plan that City Council is getting ready to vote on. It is still open for comment for a few more days. And you can see that on, for Greensboro folks, Greensboro Neighborhood Development's webpage. And lots going on here locally. We really appreciate the panelists for giving us your time, attention, and information. This has been an extremely informative panel, and will take us a little while to digest and deconstruct. I will have the Zoom chat links up on our page shortly. It may take me into the weekend to get that all compiled. We will have the recording up as well. On the webpage, page, which has been posted multiple times in the chat. We have all of the PowerPoints that have been presented as PDFs so that they're easy to download. If you just go to chcs.uncg.edu and look down at the posts, you'll find it pretty easily. We appreciate everybody for coming again, and we'll see you again in 1 month, the first Friday in October. Thank you all so much.
Thanks, everybody. Thanks, Stephen.
Thank you, Rob.
Thank you.
Thanks, Jennifer.
Have a great weekend, everyone.
Bye.
Thanks. Bye.
Have a safe weekend.
Thank you, Marianne.